Hello ပရိသတ်တွေအားလုံးပဲမင်္ဂလာပါရှင် Healthfix အစီအစဉ်ကြိုဆိုလိုက်ပါတယ်။လောင်တို့ဒီနေ့မှာလည်းကျန်းမာရေးနဲ့ပတ်သက်တဲ့အကြောင်းအရာတွေကိုဆွေးနွေးဖို့ရှိမှာဖြစ်ပါတယ်ရှင်။ဒီနေ့မှာတော့လောင်တို့ကလေးတွေရဲ့နှလုံးရောဂါအပိုင်းနဲ့ပတ်သက်ပြီးတော့ဆွေးနွေးသွားမှာပါ။မွေးရပါနှလုံးရောဂါရှိတဲ့ကလေးငယ်တွေအတွက်ကိုဆွေးနွေးသွားမယ့်နေ့လည်းဖြစ်ပါတယ်ရှင်။ Hi Fix Paul မင်္ဂလာပါ။ဒီနေ့ဆွေးနွေးမှုမှာတော့မလေးရှားမှာရှိတဲ့ Professor Dr. Sivakumar ကနေလာရောက်ပြီးတော့ဆွေးနွေးပေးမှာပါ။ Professor Dr. Sivakumar ဆိုလို့ရှိရင်တော့လောင်တို့ IJN ပေါ့နော် National Heart Institute Malaysia ရဲ့ Professor ဖြစ်ပါတယ်။သူက Senior Consultant Cardiothoracic Surgeon လည်းဖြစ်တဲ့ Professor Dr. Sivakumar ဖြစ်ပါတယ်ရှင်။ဆရာကြီးကိုဖိတ်ခေါ်ပြီးတော့ဆွေးနွေးမှာဖြစ်ပါတယ်ရှင်။ May I cordially invite our professor?
မင်္ဂလာပါလာဘူး
မင်္ဂလာပါ
မင်္ဂလာပါ Fix Bot မင်္ဂလာပါ
Minglava, Dr. Siva. It's such an honor to meet you, sir.
Thank you.
Thank you so much for giving your time to Healthfix.
Thank you.
First, would you like to introduce yourself to Healthfix audience, please?
Minglaba, my name is Dr. Sivakumar Sivalingam. I'm a congenital heart surgeon. I'm a senior consultant practicing at the National Heart Institute. I'm also the clinical director for congenital heart surgery at the hospital. And I've been involved in a lot of training and providing service, and also in a lot of overseas missions, and especially here in Myanmar.
Oh, thank you. So how serious is the problem of congenital heart disease in children in Myanmar so far?
Well, if you look at the incidence of congenital heart disease in any country, it can be about 8 to 10 per 1,000 live births. So based on the live births in Myanmar, I think the total number of cases that you detect will be about 6 to 8,000 cases a year. So these are rough estimates. We don't have the actual numbers. In that number, probably half of the children will need some kind of treatment. And so that would be around 4,000 children will need some kind of a treatment for these patients. So it's a fairly large large number of incidents of disease, but because congenital heart disease is the most commonest congenital heart lesion, compared to all other congenital lesions, that's the most common. Yeah.
May I know the ways of detecting and diagnosing the congenital heart disease in children also?
So I think now, as science has advanced, many in the advanced countries, many a times the detection takes place in the fetal period itself. So I think so that this is mainly to either give the options for the parents to continue the pregnancy, or to give a plan if the child is born, how do we treat the children with congenital heart disease. But in our part of the world, most of the time it's only detected after birth. So the presentation of the condition is what determines how early you can detect. There are some children will come in with very serious symptoms. So then you will go and diagnose with further investigations. But there are also many who do not have any symptoms at all. They may even just be well until they are they are big adults. So it varies. So I think it all depends on how they present and at what age they present. Once they are detected, then of course we will need to do a lot of investigations, that's in the form of imaging, in order to diagnose what kind of heart lesion do they have, in order to provide the appropriate kind of treatment.
So what are the procedures and treatment to the congenital heart disease in children in Myanmar?
So I think Myanmar has kind of evolved over the last 10 years since I visited Myanmar, and I think the main issue is that we have the detection of the children with congenital heart disease. So many a times they come in fairly at a later stage of life, even though they have symptoms, they don't have access to care, so they come in pretty late to life. But most of the time, most of the basic treatment can be given in Myanmar, and I think the most lesions that are simple cardiac lesions need not be treated with surgery. You can probably treat them with medications, and also you know, the cardiologist can put in devices to close, like hole in the heart can be closed with a device. So in order to avoid major surgeries, there are, if you can't treat them with more conservative kind of management, then you will need to go in for surgical treatment. So the surgical treatment depends on whether they have a simple heart lesion, like a hole in the heart, or they can have more complex, complicated heart lesions, like you know, anomalies in the you know, the blood supply to the heart, the anomalies to the blood flow coming in and going out of the heart. So these are all the various variations that you can have, and you know, there are nearly 100 over variation of you know, diseases in congenital heart disease, and so each has a tailored kind of procedure. So in Myanmar, most of the simple congenital heart lesions can be treated. I think they have an excellent setup. It's just that, you know, they need to have more doctors who can provide the service, but it all can be done.
Thank you so much for giving your time to HealthFix program, and I would like to deeply appreciate your effort to Myanmar children also. Thank you so much, Professor.
It's always been a pleasure being in Myanmar, and thank you for inviting me here, Lavun, and thank you, Fixbot, and thanks to all the audience, and we look forward to working further in collaborating with this beautiful country.
Thank you so much, Dr. Sival.
Thank you so much.
အခုဆိုလို့ရှိရင်တော့ဒီ IGN Malaysia က Dr. Siva ကနေပြီးတော့မွေးရပါနှလုံးရောဂါရှိတဲ့ကလေးငယ်တွေမြန်မာနိုင်ငံမှာသူဘယ်လောက်ထိကုသခဲ့လဲဆိုတဲ့အပိုင်းတွေရဲ့နောက်ဒီယောဂါရဲ့နည်းနည်းမှုအပိုင်းတွေပြီးဖြစ်ပေါ်တဲ့အနေအထားလိုက်ကိုဒါကုသမှုပေးနိုင်တဲ့အပိုင်းတွေပါဆွေးနွေးပေးသွားတာဖြစ်တဲ့အတွက် HealthFix အစီအစဉ်ကိုကြည့်ရှုရပရိသတ်တွေနှစ်သက်မယ်လို့ထင်ပါတယ်ရှင်ဒီနေ့အကြောင်းအရာဒီလောက်နဲ့ပဲနှုတ်ဆက်ချင်ပါတယ်ရှင်မွေးရပါကလေးရဲ့နှလုံးရောဂါနဲ့ပတ်သက်ပြီးတော့အများကြီးသိလိုက်ရမယ်လို့ထင်ပါတယ်နောက်နေ့မှာလည်းမတူညီတဲ့တင်ဆက်မှုတွေကိုပြသသွားအောင်မှာဖြစ်ပါတယ်ရှင် Bye bye.
Bye bye.
အခုပြသသွားတဲ့ HealthFix အစီအစဉ်ကိုပြန်လည်ကြည့်ရှုမယ်ဆိုရင်တော့ပြုံး Play application မှာကြည့်ရှုလို့ရတဲ့အပြင်ပြုံး Play YouTube မှာလည်းကြည့်လို့ရတဲ့အကြောင်းသတင်းကောင်းပါချင်ပါတယ်ပရိသတ်တွေအတွက်ကျန်းမာရေးပိုင်းဆိုင်ရာအကြောင်းအရာတွေကိုအမြဲတမ်းတင်ဆက်ပေးသွားမယ် HealthFix အစီအစဉ်